Hey everyone, my name is Jack Wang, CEO of Longhorn Financial. Welcome to Webinar Wednesday. It's great to have everybody on the call today. We at Longhorn Financial, we help families maximize financial aid, lower the cost of college, and pay for college and still be able to retire. And I am really thrilled today to have my friend Scott Maibor of Senior Benefits Boston on the line with us. Today we'll be discussing Medicare 101. It's great information, important. So welcome, Scott. Great to have you on.
Thank you very much, Jack, for having me.
Awesome. And let me just share with everyone a little bit about Scott. Scott has been doing voluntary benefits and insurance for about a dozen years now. And today he specializes in Medicare, as he has for the last several years, but he specializes in helping people with Medicare. Specifically, he works with individuals, employers, other financial professionals, such as myself, and various groups to explain how the Medicare system works, because he is a strong believer that any person 64 or older should have a basic understanding of Medicare so that they can make informed decisions regarding their health insurance. And on that basis, he can, in often cases, he can find significant savings or help people find better coverage by understanding how health insurance, and again, specifically Medicare, how that works. He is a graduate of Babson College. He recently married his wife, and they currently live in Winthrop with their cat. Together, they have 3 children ranging from ages 19 to 30. And when he is not cooking, when he's not working, he likes to cook, bake bread, sail, fish, kayak, hike, and read. And he takes awesome videos from his backyard of the ocean all the time, right? Which you post on your Facebook page. So I'm very jealous of that. So, let's get right into this. So let's just set some basic information here for everyone. So briefly, just tell everyone about the 4 parts of Medicare, sort of what it is, what it covers, just kind of level set for everyone here, please.
Okay, great. Thank you, Jack, again for having me. So Medicare is broken up into parts, and everybody's familiar with the letters, but there's always a lot of confusion in what the letters actually cover. So Part A is room and board at the hospital. It is typically with no premium. So a lot of people, when they turn 65, sign up for Part A because there is no premium. There's no harm in having it. If you're on an employer's plan, it probably won't do much for you, but a lot of people do have it, and you get your Medicare card and it simply says Part A on it. Part B has a premium, and that's the one that really covers all the medical services, doctor's visits, some administered medications, surgeries, outpatient procedures, all of those kinds of things are Part B. The standard, quote unquote, rate for Part B, this $144 per month per person. So $145 a month per person per month. That is Medicare. That is standard Medicare. That's A and B from the government. And then there is a Part C, which is an Advantage plan, which is an HMO style plan, which technically replaces traditional Medicare, but it gives you the additional services and helps people pay for the some of the co-pays affiliated with regular Medicare. You also have the advantage of going with a Medigap or a Med Sup plan, Medicare supplement plan, which is another way to take care of the co-pays and out-of-pockets with Medicare. And then, of course, Part D, the drug plan, which you are required to have, and if you don't have it, when you eventually sign up for one, you will have a penalty.
Okay, all right, good. Thank you for that. So, again, there's a lot of confusion around sort of what it covers and what doesn't cover. But before we get to that, so when can people actually enroll in Medicare? What age, right? Because some people work a lot longer and retire later. Other people want to retire early. But when can people actually get into Medicare under normal circumstances?
So your initial enrollment starts 3 months before the month you turn 65. So assuming you're just not disabled, if you're turning 65 in August, you can sign up in May. and it would be effective August 1st.
Okay. And so that's 65 for pretty much everyone. Now let's talk a little about and we do get questions on this all the time about, but Scott, what if I want to keep working, right? So if I'm working till 70 or whatever, and I have health insurance through my employer, when I finally do decide to retire at 68, 70, 72, whatever that may be, is it too late to enroll in Medicare? Will I be penalized, or can I enroll then because I have employer coverage all the way through that time?
Okay. So when you turn 65, that's called your initial enrollment, or some people refer to it as the IEP. Any special enrollment, so if you were retiring next month, then you would set up Medicare to start on basically the day your employer's coverage ends. So for many people, you obviously don't want an overlap and pay for two plans simultaneously. So if you're retiring June 30th, you would set up your Medicare to start July 1st. There is no penalty because you're required to have coverage effectively, but it does not have to be Medicare if you or your spouse has coverage that satisfies the Medicare requirements from an employer. And so that, if the employer is less than 20, then you're required to have Medicare. Many municipal employees are required to have Medicare because they're on the state's GIC program. So there's caveats, and you have to be careful, because if you think you're covered on an employer, or you are covered on an employer's plan, but there's less than 20, you could still be subject to a penalty down the road.
Okay, so what you're saying is, excuse me. So if I'm working till 70, and as long as my coverage qualifies, right, and my employer coverage qualifies, then I can enroll in Medicare at 70 when I finally retire, right? Like I don't have to do it at 65, right? Is what you're saying.
Correct. It's entirely up to the individual when they enroll. What I usually tell people is, when you're 65 or approaching 65, it's well worth comparing Medicare to what your employer offers, or your spouse's employer, just so you understand how it works and how it compares. And when the time comes, you'll be in better shape than the vast majority of people I see.
Okay. So there is also this question about COBRA, right? So again, just same scenario. I'm working till whatever age, 60, 70. Now, you just said that I can then enroll in Medicare, but what if I really like my employer plan for whatever reason, right? And so once I leave work, most of the time I can qualify for COBRA and extend that employer coverage for another 18 months. Yeah, I got to pay for it, but I can keep it for 18 months. Can I take COBRA for that, however much time I want, up to 18 months, and then go on to Medicare?
So you can, but you will be penalized after 6 months. So COBRA does not count as coverage from an employer. COBRA, even if it's the same plan and the plan itself qualifies, because it's not an employer supplied plan, because technically you don't have an employer anymore, it will not count as creditable coverage, and Medicare will penalize you, will assess a penalty to you for having COBRA rather than taking Medicare.
Wow. Okay. And I know we talked before outside of this, and that penalty is permanent, right? That penalty is lifetime if you are in a situation where you have to pay it.
Right. Once the penalty is assessed, and it applies to Parts B and Part D, and once that penalty is assessed, the penalty is there for as long as you're on Medicare, so effectively a lifetime penalty.
Wow. Okay. Yeah. So we definitely don't want that. I mean, health insurance generally is expensive enough. We don't want to pay any more penalties that we have to. So you did talk a little bit about Medigap plans and also Medicare Advantage plans. And of course, if you watch any kind of daytime television, particularly now that we're all at home, you see these commercials all the time, right? With older celebrities pitching these things. So can you just explain the difference and generally what a Medigap plan is versus a Medicare Advantage plan?
Sure. So as I said, A and B comes from the federal government. Everything else is coming from a private insurance company. And in Massachusetts, you really only have 6 carriers for the Medigap and the Advantage plans. So a Medigap plan, also a Medicare supplement, they're one and the same. It's designed to do exactly as it sounds. It fills in the gaps that Medicare didn't pay for. So for instance, Part B has a 20% copay. So Medicare pays 80%, you're responsible for 20%. And that 20% could be substantial if it's an outpatient surgery and whatnot. If you have a Medigap plan, you pay nothing. Medicare has a copay on Part A for the first night in the hospital, $1,700. If you have a Medigap plan, that's covered. So with a Medigap plan, you're paying a fixed monthly fee. You have no copays on any of the Medicare costs. I'm sorry, you have a question?
No. Go ahead. Sorry, Scott.
An Advantage plan, but you still have A and B. So you have A and B, you have a supplement, and then you are required to have a standalone drug plan as well. If you have an Advantage plan, you've kind of rolled it all into one. There are newer way to do this. It gives you from a particular carrier, and it's the same carriers in Massachusetts, but you're having an HMO or a PPO style plan where all your coverage is coming from that carrier. So let's pick on AARP because they do a lot of advertising with older celebrities. You have a PPO in most cases or an HMO, but United Healthcare AARP is your provider, and they're going to give you your drug plan, just like it's very similar to the plans people have now. You have copays. You go to the doctor, you may have a $5 copay, you may have a $30 copay, and depending on what's done is the amount of the copay, but it's all being billed through the carrier of choice. And then they can include, and they roll in a drug plan, so you have one plan that covers everything.
Okay, so basically a Medicare Advantage plan is just really kind of taking all those pieces and just rolling into one plan effectively. Yep. So I
was just going to interrupt and say one thing that surprises a lot of people, if they have A and B and a supplement and a drug plan, Medicaid doesn't cover routine dental and vision. So many cases you also need to add a dental plan there as well.
Right, but so that brings up an interesting question. So if someone were to get a Medicare Advantage plan, like you said, the AARP, United Healthcare, are there, or would some of those plans include dental and vision that normal Medicare would not cover?
Yes. So the trends, especially, and it really took off this year, is that the trend is to include at very little or no premium on the Advantage plans, all the extras that people feel they're missing. So with the Advantage plans, you're typically going to have some dental coverage, and it will vary by carrier. Vision coverage, hearing aids, gym memberships, smoking cessation, weight loss programs, all these little extras that they throw into the plan that are things people want and obviously makes the plan more attractive.
And, so what you're describing is very similar to, if you have a pretty good employer plan, I mean, it really sounds like it's just Medicare Advantage is really sort of under the Medicare sort of umbrella, but it's just a version of an employer plan that you might get today. And
it's very similar, but with some key advantages that I think very few people have actually sat down and really studied their employer plan. It is what it is. This is what they offer. So this is what I signed up for. But I think you'll find in many cases, these plans are lower in premium. You do have to pay your Part B, but little or no premium on these. In addition to that, no deductibles. So whereas most plans now have a $1,000 or $3,000 deductible, this plan has zero deductible, and it includes all the other extras. And if it's a PPO, you can go out of network. So a lot of people like that.
Okay. So, we did have a question come in advance, and someone who is still working over 65 and has already signed up for Part A. So they have Part A, but they don't have Part B because they are covered through their employer healthcare plan at work, right? So the question is, even though that they're still working, should they sign up for Part B? And if not, when should they sign up for Part B? I think we've kind of covered this, but can you just explain that just a little bit more in that scenario?
Sure. If you're on your employer's health plan, you don't want to sign up for Part B because then you're truly double paying. And I actually see people who do this quite frequently. If you are going to go off your employer's health plan, and that doesn't necessarily mean you're not going to be working anymore. You may just not like their new health plan. Shortly before, a month, let's say 6 weeks or a month before you intend to go off the employer's plan, sign up for Part B. And one caveat, if you've signed up for Part A, most people do it right online on the Social Security website. You can't do it online to add Part B. So once you have Part A, you cannot add Part B online. You need a paper form. And in COVID world, this is becoming more complicated because there's nobody at the Social Security office, and you can't mail it to the Social Security. You can, but there's very few people there to process anything. So they've allowed people to fax in the form, but processing times are very slow. And I'm seeing a lot of people who are considering now Medicare for the first time. They don't know it, they've been laid off, or they have reduced hours. They don't know if they will be going back ever, or they'll be going back at reduced hours. And now they're thinking, maybe I should add Medicare and decouple my health insurance from my employer.
So it's interesting that you bring that up. I kind of laugh a little bit. So, in this case, they go from paper to state-of-the-art 1980s technology with a fax machine, right? So one day, perhaps in the, couple hundred years in the future, they'll actually go to an online form for this, which what it sounds like. But it's interesting that you bring up this notion of, and during this crisis time, people have lost their jobs, right? They've been furloughed or they've been laid off, unfortunately. And so there's a lot of people in this boat, right? They're maybe close to retirement time anyway, and they lost their job. So this is something that they really should look at quite closely, right? Because even if they go back, like you said, they may not want to go back on their employer plan. They might be better off with Medicare.
In many cases, they are better off. I have people who turn 65 meet with me, and they're like, "This is much less expensive than my employer plan. Why wouldn't I do this? You can still work full time and have Medicare." But I'm working with a family up on the North Shore. The woman, she's 74, I believe. She's been on an employer plan. She worked at a large retailer at the mall, and she's just been furloughed. They have kept all employees on the plan till the end of June. But she doesn't know if she'll ever go back. Her kids are saying, maybe it's just time to retire. So we're looking at, and luckily we have time because they're keeping her on till the end of June. But we can weigh all of the pros and cons of the various plans and put her on Medicare. And maybe she goes back 1 or 2 days a week, but they're not going to give her health insurance at that point. But like her son that I spoke to yesterday said, it would be nice to have her have some additional flexibility and not have to take that other 2 shifts just to cover the hours.
Right. And that totally makes sense. That's a great story. So one of the things that people often complain about when it comes to healthcare is just the premiums, right? And so premiums only ever seem to go up. Medicare, like you said, Part B, Part D, and Medicare Advantage plans certainly have premiums, but there are also things that people do to cause their own premiums to go up, and that aren't necessarily health issue related, right? Can you talk a little bit about that and sort of what happens or why premiums might go up on Medicare, even though you didn't get sick?
So Medicare, and this applies to Part B and Part D, so the drug plan and the Part B, have something called an IRMA adjustment. So it's the income-related Medicare annual assessment. And what happens is when I talk about Medicare Part B, I'm talking about $145 a month is what they refer to as the standard rate. But that's adjustable based on your modified adjusted gross income. So if you're a high income earner, you will pay more than that. And what surprises people is they say, I'm not a high income earner, but when they retired, they took a withdrawal from their 401k to maybe pay off the mortgage or pay off some credit card debt, or they've sold a piece of property. Well, that all impacts your adjusted gross income. So all of a sudden, you don't think, you're thinking, I'm a moderate income earner, but not according to your tax form, and that's what they're basing it on. So you could pay as much as $500 a month. for your income, and it's stepped. There's 4 levels.
Wow. So some of those one-time events, hey, I had to take a little extra out of the 401k because I want to redo my kitchen or whatever. That impacts the premium. And so that has nothing to do with you getting sick or adding additional coverage. It's you did this other thing that's completely unrelated to health insurance, and bam, your Medicare premium goes up,
Yep.
right?
And things have changed slightly right now, but RMDs are a big thing. If somebody's done a lot of savings in a qualified plan, then their RMDs can push them over into the next level.
Right. And RMDs, just for everyone, if you're not familiar with the term, require minimum distributions out of your retirement plan, which have been temporarily suspended for 2020 under the last stimulus act that was passed. So here's a question though, but people don't always take out large chunks of money from their 401k or sell a piece of property, right? That may not be an annual thing. RMDs, right, every year would be, but taking out extra wouldn't necessarily be. So does that mean that your Medicare premium could considerably go up one year, but then back down the next? Could something like that happen?
Yes. And just so people are clear, you can appeal the assessment as well. There's an appeal process on the Medicare website. I have no idea how successful people have been. I've had a couple people try it, but they haven't gotten back to me with whether it worked or not. One of them had inherited a sum of money, and it wasn't a huge sum, but it was enough to push them over the tier. But yes, your Medicare can fluctuate. The other thing that I see, interestingly enough, is that the 144.60, you'll see some people who pay a little bit less than that because there's a hold harmless clause in your Social Security. So if your Social Security went up this year, but it didn't go up as much as Medicare went up, then you get some credit, so you may not be paying the full amount.
Okay, so all right, but if you qualify for that, which I'm assuming is at probably a lower income level, so if you qualify for that, there is some good news. Maybe
Yep.
It's not as expensive as 145, but the flip side is you your income has to be low enough for that to happen, right? So
Right.
that's not always a win. Okay, so there are also a lot of misconceptions around Medicare in terms of things that it does cover and things that it doesn't cover. So we've talked a little bit about that already in terms of dental and the vision, things like that, where it may qualify under an Advantage plan, but not necessarily the straight Medicare itself. What are some of the other common misconceptions about Medicare and sort of things that people think that it covers, but it doesn't, or vice versa?
I think the biggest misconception is that it's not good coverage. The truth of the matter is, if somebody's ill or has a lot of health concerns, I don't think you could touch Medicare, because I think any plan you show me from an employer, for somebody who's using the plan quite a bit, either between premiums, copays, and deductibles, I think Medicare is going to beat it, because here's a plan that has no copays or deductibles, aside from a $200 deductible, no matter what you have done. So in any given year, there's no maximum out of pocket. The maximum out of pocket is $200 in addition to the premium. So, you could have surgery and walk out without a copay. You can have hip replacement, knee replacement, get into a car accident, and it costs you nothing. So for those who have the budget to cover the flat monthly fee, it can be a phenomenal plan, much more cost effective than paying copays along the way. Some other things that I think people are generally surprised about: Medicare will not pay for an annual physical. So I have an app on my phone that actually says what Medicare will pay for and what it doesn't, in case the questions come up. But an annual physical, they pay for an annual wellness visit, but not an annual physical. And it's surprising to a lot of people, but if your doctor bills an annual physical, you're going to get a bill for 100% of that, because Medicare will reject that. So if they miscode the wellness visit as a physical, you're out of luck.
Yeah, that's so odd. I didn't know that. And in my mind, I guess, what's the difference? But I guess it's just the code, right?
There are technical differences, I guess, in how they're ordering the subsequent tests, whereas a physical, the tests are going to be done whether you need them or not. And a wellness is they only do tests if they're needed.
Okay.
But, you know, if like you, most people call up and say, hey, it's time for my physical. Let's
Right.
order it. And then you get a bill from Medicare saying, sorry, this isn't a covered service. You owe the doctor's office $250.
Wow. Okay. One other thing that I often hear is around coverage for long-term care, Medicare and long-term care. What's the story there?
So Medicare does not pay for long-term care. And I'll repeat that. There is no long-term care coverage through Medicare. There is rehabilitation, or what they call skilled nursing, and the key difference is it's not permanent. You may not be well enough to go home, but you can't stay in the hospital any longer. It's that interim step. Long-term care is basically a permanent situation. The services can be given to you at home or in a facility, but it's permanent. And Mass Health or Medicaid pay for long-term care. You may not like the facility they approve for you, but in order to qualify for Mass Health, you have to be indigent. So it's an income of less than $1,000. It's less than $3,000 of liquid assets. If you own a home, they will put a lien against it. So if you have assets, you know, I always encourage people to make sure you have wills and potentially trusts in place. There's a time look back on that. Long-term care insurance in some cases makes sense. If you're going the Medicaid route, if that's the plan, then you know you want to try to have as few assets in your name as possible.
Right, and that's a topic that is very scary for a lot of people, and that'll probably have to be a subject of another webinar Wednesday. That'll be the horror movie version of webinar Wednesday, because they can get really scary really fast. Just as we're wrapping up here, Scott, why don't you share your contact information so that if anybody would like to has more questions or would like to contact you directly to figure out what's best for them, they can get in touch with you.
Sure. So my email address is Scott, SCOTT, at SB Boston, so Senior Benefits Boston, sbboston.org. You can go to our Facebook page, which is Facebook Senior Boston. My phone number is 17721250. Feel free to reach out to me with any question. I'm happy to help.
Awesome. Thank you, Scott. Thanks, everyone, for being on this episode of Webinar Wednesday. Stay tuned. You'll get an email for the replay of this webinar for anyone who is already registered. And Scott's contact information will also be in that email. We do topics every week. So you'll get a link to a survey. So please share with us your thoughts on what topic you'd like to see. And please make sure to register for future webinars. Again, always Wednesdays at 7 p.m. So again, I'd like to thank Scott for spending the time with us. Great to see you as always. And everyone stay safe and have a great day.
Thank you, Jack, for having me.